We have a 69-year-old African-American male who presents to the clinic with the chief complaint that it feels like an elephant is sitting on my chest. Patient states that the chest pain has been going on for more than 20 minutes at a time and that it started 4 hours ago while resting in his couch. The patient states that the chest pain is unrelieved by 3 doses of sublingual nitroglycerin and describes the pain as a substernal heaviness radiating from his left arm. He is also experiencing some diaphoresis, and upon further questioning, he also mentions that he has had chest pain off and on for the past couple of weeks while working out in his yard, and was able to alleviate that pain with 1 to 2 doses of sublingual nitroglycerin. The patient has no known drug allergies and has a past medical history of coronary artery disease with a PCI drug-eluting stent placed 5 years ago. The patient also has hypertension, dyslipidemia, GERD, and osteoarthritis. The patient has a family history of heart failure, as his father died from it at the age of 72. His mother was diagnosed with breast cancer at the age of 70. The patient is positive for alcohol use, positive for tobacco use, but quit 5 years ago when he has stent placed, and is negative for illicit drug use. The patient is taking 81 milligrams of aspirin PO daily, metoprolol tartrate, 25 milligrams PO BID, simvastatin 40 milligrams PO QHS, some sublingual nitroglycerin, 0.4 milligrams as needed for chest pain, omeprazole 20 milligrams QAM, ibuprofen 400 milligrams QH every 4 hours as needed for pain. And his labs are all within normal limits except for an elevated blood pressure of 163/98, a BUN of 19 milligrams per deciliter, an elevated LDL of 145 milligrams per deciliter, triglycerides of 247 milligrams per deciliter, total cholesterol of 226 milligrams per deciliter, a decreased HDL of 32 milligrams per deciliter, as well as a creatinine clearance of 76 milliliters per minute. Based on the patient's HPI, past medical history, an elevated ST segment on his ECG results, consistent with the acute inferior MI, uncontrolled hypertension, his age, family history, his BMI of 29.5, we believe that the patient is suffering from a STEMI, and short-term goals for him include early restoration of blood flow, prevention of death, relief of ischemic discomfort, and resolution of the ST segment and T-wave changes on his ECG. We will treat the patient according to the ACC/AHA guidelines for a STEMI, as well as initiate PCI therapy. Long-term goals for this patient include improving the patient's quality of life, control of CV risk factors, and prevention of further CV events. As per the ACC/AHA guidelines, the patient would also greatly benefit from being placed on a beta blocker, ACE inhibitor, and a high-intensity statin. For this patient, we want to initiate oxygen and keep them to titrate to up to oxygen saturation of greater than 92%. We want to give him IV morphine, 4 milligrams bolus, and then give him 2 milligrams every 5 to 15 minutes as needed for pain. We want to do a PCI within 90 minutes of first medical contact. During PCI, we want to administer an anticoagulation and antiplatelet therapy with a loading dose of aspirin of 325 milligrams by mouth, and then continue with his usual 81 milligrams PO daily dose indefinitely. We want to give him clopidogrel, a loading dose of 600 milligrams, then continue with a 75 milligram daily dose for 12 months. We want to give him unfractionated heparin, 70 units per kilogram, an IV bolus to maintain a therapeutic ACT of 300 to 350 seconds. We want to give him IV metoprolol within the first 24 hours, 5 milligrams every 5 minutes as needed to titrate for heart rate and blood pressure. We want to give him metoprolol succinate, 100 milligrams PO daily, lisinopril 10 milligrams PO daily, rosuvastatin 20 milligrams PO at bedtime, and continuous sublingual nitroglycerin therapy. We will monitor the patient we will follow up with him within 4 weeks. We assess his labs. We will monitor for signs of bleeding due to the clopidogrel and his aspirin. We want to monitor hypotension due to his amlodipine and metoprolol. And we want to get new lipid panels for LDLs, and to monitor the effectiveness of rosuvastatin, monitor drug adherence and compliance. We want to advise the patient to call 911 if his first dose of nitroglycerin is ineffective to alleviating his chest pain, and to continue taking his dose every 5 minutes, up to 3 doses. We also recommend that the patient continues to monitor his diet and to exercise for at least 5 days a week for 30 minutes at a time.